can be detected, and it can also be extrapolated to the caregivers. They can also be alarmed and sensed for such complications.
I think the session is open for questions. As we are running late, we'll limit the time to 5 minutes.
Good afternoon, ma'am. How long we can use sulfonylurea, ma'am? Is there any limit to use glimepiride 2 mg, 4 mg, 10 years, 15 years? Because it's a progressive disease, diabetes. How can we find its sulfonylurea failure like that and all in a general practice?
All the patients have to be followed up regularly. As long as the durability depends on, see, I always tell my patients, whatever medication you give, unless they change their lifestyle, restrict the carbohydrate, and do proper physical activity, any medication you are going to give is going to fail. So our guidelines say that if you are having a HbA1c of more than, say, 7.5 in elderly patient, 7 in a younger patient, then possibly it is a failure and you need to escalate the treatment. Either increase the dose or you have to introduce a new medication. So it is not that that drug is failing. It is a part of problem with the patient as well.
So in the first case, is there any possibility of using short-term insulin therapy, sir? Since the patient,
when the patient is presenting with a very high blood sugar, symptomatic, then possibility of giving there are evidence that if you give insulin short term, about 1 or 2 weeks, and then change over to oral hypoglycemic agents, then the blood sugar will be remaining in a normal range for a longer duration of time. So yes, when the patient is symptomatic and the HbA1c more than 10, yes, insulin therapy short term would be a best option.
So we can use glimepiride for a short while, and then we can wait and can use insulin as a for the patient.
First start panni.
Yeah,
short. See, no. You can use. I mean, if the patient is symptomatic, very high blood sugar, then possibly. I mean, they have a criteria of the fasting is more than 200. Postprandial, you don't need to consider postprandial. Fasting is more than 200. If the HbA1c is more than 10, they mean that the patient is having insulin deficiency, maybe glucotoxicity.
Thank you.
So my question on CGM. So we know that HbA1c is not very reliable when there are coexisting conditions like chronic kidney disease and liver disease. What about the accuracy of CGMs in such patients with kidney disease or liver disease? Is there any problem because of the metabolic derangements in interstitial blood glucose monitoring?
So there are data so that even in CKD patients, TR is a valuable indicator to show that there is improvement in the many microvascular complication. But the accuracy, I don't think so. It changes in CKD or other population also. There is no specific guidelines or mention on it, so we can very well use in CKD also.
One more, sir. You told about Freestyle Library Pro and Medtronics, that is Guardian, which is the common things which are available for us to use. From your practical experience, like, do you find any significant differences, not in terms of accuracy, but even in terms of technical aspects? For example, this loss signal and that data gap, or like frequent falling of that sensor, something like that, if you find.
Yeah, this happens mostly with Abbott, as it has to be weighed in the arm. That's the preferred site. So many times the fall of the sensor is more common with the Abbott Freestyle, whereas in Medtronic it's very rarely we see those kind of problems. And but nowadays, as because of the cost, Abbott is slightly cheaper than this Medtronic. We prefer to use that also, and it gives a 14 days values also. So what I do in my clinical practice, after insertion, I call them after 7 days to see what are the readings. Then it's better to intervene the prescription or change the lifestyle, so that after 14 days we can see
get a review.
what are the changes happening also. That helps in making the changes, and patients also will understand. So due to that purpose, I prefer more Freestyle rather than Medtronic.
So So thank you very much, dear speakers and chairpersons. We'll bring that session to the close. So can I request the chairpersons to felicitate our speakers? And can I request Dr. Vijay Bhaskar Reddy to felicitate our chairpersons, please?